I will spend only a short minute because I want to make sure that the team has an opportunity to really highlight some of the great things that have been done this year with Phil, Tracy, and Adrian investing quite a bit of time. I want to reflect, you made a comment about making sure that things are sustainable, and that's been a conversation we've had quite a bit. That it's one thing for us to execute a contract with a local or a disadvantaged business. However, that doesn't necessarily ensure that that business is going to thrive or that we, in fact, will do any business with that company because it requires us engaging with the operators and the leaders across the organization to both communicate and make sure they're aware and access and take advantage of the agreements. So there's been a lot of focus on that over the past year. There's also been a lot of collaboration with other groups, whether that's the HAN, with Rutgers, trying to engage students to help us advance some of the projects that we're working on. So it really is taking a broad effort and engagement with a lot of very diverse constituencies across not only New Jersey, but the country. So I really want to commend the team for all the work that they have been able to accomplish this year. And I know that we will continue to advance it in 2022. So with that, I'm going to turn this over to Phil and let Phil expand upon the work that has been done. And then I think Phil will also engage with Adrian and Tracy as part of that process. So Phil.
Thank you very much, Bob, and thank you everybody for giving us an opportunity to tell you what we've done. Some pretty cool and amazing things have happened within this last year for us as we look at this the social impact and community investment. So Dan, do you want to jump ahead? So we're going to talk about some of the things we did in 2021. We'll talk about some of the focuses that we have for 2022. I'll go over some of the collaboratives that RWJ is part of, talk about some of the movement there. And then we'll go into highlighting one or two of our vendors and talk about something that has been on the forefront of everybody's mind, and that's data. How do we get it? How do we use it? And the great strides that we've made with inside there. So as everybody has been through, in 2019 we were coming into COVID, and during 2020 a lot of things did stop. During that time, supply chain still was able to contract with several local vendors that were able to provide us with some necessary PPE that we were looking for. We were also able to help Diana distribute PPE kits to the local community. So while we couldn't move some of the businesses forward, we were able to still look at ways to reinvest in the local communities and help the local communities during that time. When we came out of that, 2021 really was an opportunity for us to focus on a lot of good things. We enhanced our analytics and reporting capabilities. So we now have a dashboard that can break down by small, local, diverse businesses. We've also been able to further enhance our understanding of our own landscape beyond the acutes. So we've been able to bring in such areas as the BHMG and the PE side of the equation. So we have a greater transparency into what's actually happening in those areas. On those two things, I'll introduce Adrian in a few minutes, who'll walk you through those dashboards. We've increased our technology use. We've put such tools and platforms in place as PaymentWorks. PaymentWorks is actually a vendor onboarding process that we use across the organization, regardless of the vendor. However, what it helps us do here is capture the certificates that allow us truly to report on whether a business is diverse or local. So having that up front and at the onboarding of these vendors has helped us categorize a lot of these vendors in terms of spend. We've also implemented a new contract management system, ECDION, which is the manufacturer contracts is the program. And what this has helped us is basically be able to simplify the process. We've been able to streamline some of the approvals that have to happen. We've taken the contract or contracts that are several pages long and have condensed that into what's a local friendly agreement so that we can produce a faster turnaround on these things and then enter into these business relationships a lot sooner. Some of the things that we did do in terms of the relationships with vendors, we hired a new small local women-owned business called Vi Healthcare. What Vi Healthcare is, it is a benchmarking and categorization company that helps us look at the purchase service side of the equation. So basically anything that we do in the organization from a purchase service, whether that be from our blood distribution all the way down to our cleaning services, we can now look at those vendors. We can categorize those vendors. We can look at what would be considered regional benchmark. We can take it out onto a national level. So it gives us a lot more information about the vendors and about the markets that we deal in. We've also been able to continue some of the relationships that we have. In 2021, we have a repeat business of 143 vendors that we actually saw in 2020. So keeping that sustainable growth and moving them forward has always been a focus within inside the program. Another vendor that we wanted to call out is Sodexo Magic. So Sodexo Magic actually sits in 4 of our hospitals. It's over at Newark Beth Israel, Clara, Mass, Jersey City, and Hamilton. The goals of this program, as you can see there were certain things that were entitled to happen for the organization to make sure the program was successful for us. The good thing about this program is that Sodexo Magic, which is Magic Johnson, is the driving force behind this, actually gives back to the communities in various ways. So the more money that we spend with them, the more in turn they give back to the communities. And they do that by hiring locally, educating, doing community events, philanthropic donations to the community. So the more that we can continue to invest in this program and grow the program, the more the return comes back to our local communities. And as you can see, over the course of 2020 to 2021, we are continuing that growth with them and have added basically about another $300,000 to the overall expense of the program. So it's been quite beneficial for both sides. One of the biggest things I think that we have, or one of the biggest challenges that we have, is RWJBH sits on several collaboratives. We sit on the Ascend Newark Collaborative, we sit on the Democracy Collaborative, we sit on the Healthcare Anchor Network, and we sit on, the New Jersey CEO Council. And most of these collaboratives all have the same idea. They want to figure out how to take your spend and categorize it. However, it doesn't really provide the benefits that we need to assure that these businesses are going to be successful. Our job is to help identify the opportunity, is to be able to work with these vendors to grow. However, a lot of the vendors are lacking some of the technical, operational, and management skills that are necessary to grow, are necessary to move forward with an organization like RWJBH. And that's one of the things that I'm leading to is the Ascend Newark program. RWJBH partnered with the Rutgers Center for Urban Entrepreneurship and Economic Development, called CUEED, and we piloted a program through this relationship. What it was RWJ selected 10 of its existing vendors, and we put them through the Rutgers Business School and the center, a vast program, which was encompassed in 8 weeks. And during that 8 weeks, they learned how to do certain things to assure that a business relationship could move forward. Forecasting, developing business plans, being able to communicate with us on a level that would help us understand what their business needs or the struggles that may have or the expectations that we have. 10 vendors were put through. 2 unfortunately fell out of the program, were not able to complete it, but 8 were. And out of those 8, RWJ made a commitment that if they were to go through the program, it took us quite a bit. Diana and I had to go through about 30 vendors to get 10 to accept it. And the reason that 10 accepted it was that we promised that we would look at the existing opportunities and figure if there was a way to grow the business. So we created the model for the cohort. We've ran them through the program. We've had 8 vendors successfully graduate the program. And out of those 8 vendors, we are now working with them throughout the organization based on what the opportunity and the expertise of the business is to continue to grow them. One of the ones that I'd like to point out is Sock Shop of America. You've heard a lot of talk about that. It has been our jewel in the social impact program. So I would like to turn this over to Tracy Burrell Hancock, my peer, who's the VP of Facility Operations, to kind of explain what we've done with Sock Shop and how we're moving forward with sustainable growth.
Perfect.
Tracy?
Thank you. Thank you, Phil. Can you hear me?
Yes, ma'am.
Perfect. Thank you. So the current state of for this vendor currently is we are actually using their stocks in 2 of our facilities to date. As a system, we are ready to convert other hospitals. Unfortunately, there are some obstacles that we are facing. One being the vendor has reached its full capacity, and the second being they have capital restraints. So to that end, and the promise that and commitment that we've made to this vendor and all of our vendors is that we are committed to moving our relationships and the partnerships forward. So with this particular vendor, we extended this vendor a loan of $35,000 to purchase an additional knitting machine. This will allow this vendor to increase their inventory and thereby increase the business and grow the business. So the plan will be, once this vendor has the knitting machine in place and they have inventory to support our systems, the goal will be to convert the remaining hospitals. Our plan is to have those remaining hospitals converted within the next 18 to 24 months. And then after that, there are some possible opportunities with this vendor in areas of other items like baby caps or marketing products and things of that nature. So Phil, I'll kick it back to you. This vendor has been, is a success story.
Great, thank you, Tracy. The one thing and Sock Shop and these other vendors that you see listed here, the good news is that we are moving them forward. We've created a program that truly looks at opportunities inside the organization. We've put them through this program that we helped develop with Rutgers that provides them a lot of the background support that they need in order for the business relationship to move forward. And it has actually been adopted now as a model for the Ascend Newark program. And we are providing guidance to the next cohort member, which will be Prudential, on how to develop their program and how to make it as a success as RWJBH is. As I had mentioned before, we're continuing with some of the other collaboratives. We have the New Jersey CEO Council and the Health Anchor Network, also called HAN. With the HAN network, it's more focused on healthcare institutions, and we continue to develop best practices with them. However, the biggest step forward that we had was with the New Jersey CEO Council. This one allowed us to actually get the state to understand that not everybody has to segregate and look at data because the returns are just, they don't align. So we were able to be instrumental in getting the state to step up and start to look at this and figure out a way that we could aggregate this and then adapt it to what we have done in our data and analytics. So the CEO has heard us, the CEO Council has heard us, and we are actually developing this first state robust list of vendors that fall into the diverse local market space. It's about 7,000 vendors we'll now have access to. And we are tying that list over to the state certification website so we can actually align these vendors to what certifications they actually have. That in ourselves made the program incredibly more useful, and the returns that we'll get on it will be astronomical once it's in place. In 2022, where our focuses are going to be is we are going to continue to advance the RWBH portal. This is an external portal that allows vendors to understand what our opportunities are, allows vendors to register into certain categories that will give us a resource of vendors that we can choose from when opportunities are presented throughout the organization. We continue to grow with Rutgers, making sure that that back-end support is still there, and we continue to develop a statewide database that will give access to all of the information of vendors included in these categories. We want to increase our sustainable vendor contract awards. We want to make sure that these are contracts that will continue with us for several years. Excuse me. And again, as I said, we want to continue the development of the back-end support through the Rutgers School of Business. So here are our numbers. A lot of these numbers you've all heard and we've gone over them several times. I don't want to really pick the numbers apart, but what I'd really like to do is turn this over to another one of my peers, Adrian Jukta, who is our VP of Analytics and Data Management. Through the work that Adrian has been able to help with us and move forward, we have now created a robust dashboard that helps us highlight these numbers, as well as been able to develop a tool that allows us to drill down by area. And we can tell what businesses are in those areas, the type of businesses. We can tell which businesses are ours and what those businesses are doing in terms of these services. So with that, I'd like to turn this over to Adrian and have him walk you through our analytics part. Adrian?
As Phil mentioned, we've created two dashboards that we've been utilizing for this project. The first one is where we measure our updates, or we measure our minority spend. It's pulling it's pulling invoice data or spend data for the last 3 years, January 2019 to date, and we can see the dollar values that we've been spending. It's also able to break down the minority type business, if it's a woman owned and minority owned, if it's local and small business, if it's just woman owned, if it's maybe a woman owned and veteran owned at the same time. So we have the ability to drill down on each one of these specific graphs and have the ability to understand what businesses are part of the filter that we just did. As an example, if we pick 2021 spend, we can see that under women-owned businesses, we have a list of vendors that show up to the right. We can see how much of that spend for women-owned is within New Jersey or other states. We have the ability to see what the site or the business units are that are spending the dollars into these businesses. We can see trends in the middle. We can see when the vendors were also added, and ultimately at the category level, we can identify how much of these dollars are consulting, IT solutions, printing solutions, and so on. So it's a quick snapshot for us to see how we're doing, where we are, and how we're trending overall. The second dashboard that Phil mentioned was created specifically to create a strategy and visibility to the spend we have with BHMG and PE at the location level, because of the large amount of locations that we have for these practices. It was very tough for us to understand where they're geographically located. So what we've done is we've included data from different systems, our ERP system, which is our financials, but at the same time, we included data categorization from Vi Healthcare, which is a minority woman business. They've categorized all our spend, and we're able to drill down within the BHMG and PE spend at the category level. We're also able to filter with BHMG separate compared to PE. We can filter by zone. So to build a strategy, it was important to understand categorization, to understand current businesses or current vendors that we're using. But at the same time, where are these vendors servicing? So this heat map, or this map with spend, was very important in case we needed to split New Jersey by sections. If we needed to build a North Jersey spend identification, we can highlight the North Jersey spend, and it would update the whole graph to show us what are the vendors that are being used in this section, what categories these vendors are servicing, and help Phil and the supply chain team build a strategy around how we're going to split the workload. Do we need one vendor for all New Jersey? Can we do maybe a north and a south, or a central? Things of that nature, and give them ability to play and understand the data. So this is really all I have to go over the dashboards. If you have any questions, I would gladly answer.
Just quickly, a last thing to add to this is this resides on Tableau. So if access is needed for this, you certainly can get access, either, reach out or fill out a CAM to get it. The other thing is this model is the model that RWJBH developed, these analytics, and this is what we're actually working with the state now to see on how we can incorporate those 7,000 vendors and then start to allow this tool to take on a life of its own, perhaps become something that we would share on a larger spectrum with other cohorts and members of these collaboratives that we sit on. So this was a tremendous push forward that nobody else has been able to do for us anywhere else. And this was something we did internal, and it was a great move forward for us.